That was so much fun. But now moving on to our first event of the day. Margaret Moore and Dan Kendall guide us through a fireside chat on reimbursement and health coaching. We're experiencing critical shifts of our healthcare system from a sick care system to a well care system, but there is still so much more work to be done. Our services are increasingly viewed as necessary as we achieve better health outcomes, and reimbursement is finally on the horizon in order to increase financial accessibility of our services to clients who need us now more than ever. Here are Margaret Moore and Dan Kendall.
Hi, I'm Dan Kendall. Welcome to our next session. I'm the host of Digital Health Today and the founder of the Health Podcast Network. I'm really pleased to be with you here today and to bring you our next guest. In this session, we're going to dive into the history of health coaching. We're going to talk about some of the impact of CPT codes, and more importantly, how it actually is going to affect the industry and the individuals who are working to transform health and wellness coaching. With me to talk about it is Margaret Moore. Margaret is one of the founders of Health and Wellness Coaching. Margaret, thanks very much for joining me.
Thank you, Dan. It's great to be with you.
Now, as I mentioned, you're sometimes referred to as a founder of Health and Wellness Coaching. You're also called Coach Meg, so I might call you refer to you as that throughout the conversation. But I think a lot of our viewers will already know a lot about you. But for those of us who might not be as familiar with your background, can you give us a brief insight into how you got into health coaching and what it is that you do?
I would be happy to do that, Dan.
Great.
So I'm a biologist with an MBA, and I like being in new industries. And so when I finished my MBA, I got into biotechnology. In fact, in the UK, where you are right now. And so that was basically at the time the cutting edge of new medicines and vaccines and therapies. And I spent 17 years in that field. And as I was thinking about the next phase of my life, I looked around me and I noticed, even in biotech, with very smart physicians and scientists, people were not taking good care of their daily lives in a way that would both prevent disease or ameliorate chronic disease. And so I thought, gosh, what could I do about that? And I was a bit of a health nut anyway. I was exercising when I was 17. I'd already figured out weight and diet by the time I was probably 18. And I was, and I could tell, I was looking young and other people weren't, and thinking like, wow, don't other people know what to do? And are, and how are we helping them? And so as I sort of rethought where to go next, I had a dream which was that we really needed a new professional in the healthcare world whose expertise is helping people change mind and behavior, not take pills, not medical procedures, but the expertise to support people, making that a priority in their lives.
Now, I know a lot of times it's tempting to look at the current state of an industry and just presume that there have been some minor tweaks along the way. But as you just illustrated, you were basically developing a new type of professional. So can you give us a little history about over the past 10 or 15 years? I mean, we've seen it become much more popular. I mean, Google search results will show that it's actually quadrupled in about the past 12 years in terms of the amount of times that people are looking for health coaching. But from a pragmatic perspective, can you give us a little bit of a background about how it's evolved over that 15 years and where we are today? And I want to ask you next about how the pandemic is affecting the industry. But let's first of all take on some of the history. Can you give us some backstory?
When I started in 2000, so it's a little more than 15 years ago, with this vision, when I shopped around, I realized there was no curriculum to teach coaches in healthcare and wellness that would pass the test with evidence-based in the evidence-based world of medicine. Now in Europe, there is more involvement from psychologists, also in Australia, but in the US, there really wasn't a science-based coaching kind of world. So I started from scratch. I read books, I found experts, I met the experts, built a protocol with a team, like complete scratch, designed from now, of course, now it's well established. The WellCoaches protocol has been taught to 13,000 professionals in 50 years. But when I started, there was no protocol that used science-based approaches. And so we created that, we tested it. It worked in our tests in several groups. We opened our school, we started training, we continued to capture data. Now there are 12 peer-reviewed studies on the WellCoaches protocol showing significant results, and then the whole field. So I was alone in the early days. Within about 3, 4, 5 years, like mid 2000s, a couple other groups came along. By 2010, there were about a dozen programs. And at that point, I kind of, as a ringleader with Karen Lawson at the University of Minnesota, got us all together to say, we're only going to flourish if we agree on common standards and we create a national credential. You can't really make it into healthcare if you don't follow the path of other health professions. And so that group came together. It took us a few years to agree on the standards because we had lots of different worlds. And then we decided we wanted to create a national credential. And our good fortune was that the National Board of Medical Examiners, which is 105 years old, they developed the first physician licensing exams and have been they've been the responsible party for the exams that lead doctors to become licensed physicians. And they have an incredible skill set in creating robust exams. So they agreed to partner with us. They had independently identified health coaching as the next big thing. They have deep pockets, and so they put significant investment into that credential. And that meant then we also in parallel agreed that on the standards to train and educate and test the coach's skills, so that the coach would have to go through an approved program in order to sit for the exam. So that all came together. The first exam launched in 2017. We're now, I think, in our 6th cycle. And so now we had national standards in the United States, and different things going on in different countries. But a lot of people are looking to this as probably the most robust front for standards for this field.
That's great background. I mean, I think that scientific rigor and that debate, and you mentioned that it took a while for you to come up with the standards, that intellectual debate from different perspectives, I'm sure contributed to making a better product in the end. Do you agree?
Yes, because, we had a mix of psychologists and physicians, and so we each brought our own backgrounds. It sharpened our pencils for all of us. Mm-hmm. Because we were all good trainers. Like, we all knew how to we knew how to take somebody who wasn't a coach and turn them into a competent coach. And we pretty much were all drawing from the same science base. But the vigorous debate most certainly sharpened our approach to what we did. Yeah.
And you arrived at some consensus. You have these protocols and these testing mechanisms in place. So now that's all pre-2020, and this year has had a lot of surprises for us.
Yeah.
So can you tell us a little bit about how the current pandemic has affected the industry? Is this a great opportunity? Do you have a bit of a tailwind now because of what we've been encountering through the pandemic?
Well, first, January 1st, 2020, the American Medical Association, every year it publishes its new manual of all the CPT codes. And in 2019, they approved new codes for health and well-being coaching services. They named the coach as a non-physician healthcare professional certified by the National Board for Health and Wellness Coaching, or there's a second credential, which is the Certified Health Educator. So there were two groups. We partnered with them for a bunch of reasons. And so that, and we actually had to go to San Francisco to defend the codes because we had a fairly substantial attack late last year, and so that we got through that just before things shut down. Then things shut down. So our next step was then, and we'd independently been in conversations with CMS, Medicare, around the coach, clarifying the language around the coach using existing services under physician supervision. So those two things were happening, and we were really ready to start to talk to the health plans, the industry of health insurance, and the pandemic, of course, arrived, and healthcare had other things to deal with. Clearly,
Right.
there were some pretty big priorities. However, I think what happened, when we got through the shock of that first phase, and we learned that the most vulnerable people for COVID were folks with obesity and chronic disease, that in fact there was, and healthcare has never properly addressed what we call lifestyle medicine. It's never, there's not been a home, there's not been conversations. Your doctor might ask you how much do you exercise and your weight's going up, but you don't get any real support. You go home and you go back to your ways. And so I think our field kind of woke up and thought, wow, this might be the time when this field can actually play a role, and this might be a good time for me to enter into this field. So we
absolutely, and I beg your pardon. Go ahead.
No, and so yes, we have seen growth in demand for training to become a coach, as well as for the national board certification, and as healthcare has recovered a little bit, there's a new energy around. Okay, let's figure this out. What role does the coach play? What services do they deliver? How do I build the workflow around having the coach on the team?
Right. And I mean, we've seen a lot of innovation over the past few months and a lot of adoption of new technologies. Reimbursement codes and regulatory barriers have fallen away as we've had no alternative but to find new ways of delivering care. And as you mentioned, some of the populations that the industry works with are some of the more vulnerable folks. And those are the same people that are not able to access their normal care teams and care systems. So it's really, really important to have these solutions. That's why I was curious if there was a bit of momentum that was gained through this. Is this really a time to serve and a time to shine and grow while we are some of the traditional legacy systems and access and thought processes have sort of fallen away?
Yes, I think we're moving in that direction. I will say, though, because I'm also an executive coach and I work a lot with healthcare leaders, and so when you look at the system, the state of the system in the United States, COVID is, we have another wave of COVID, and that is taking up the bandwidth of most healthcare leaders right now. So I think although we're moving ahead and we're getting ourselves organized, I do think that it'll take us through this next wave, and then people will recover and say, oh, now where do we go? And
Right.
Everyone knows we've got these needs, and I think we'll be able to step into the spotlight and make our case and convince both the healthcare systems and the payers that this is important. And let me add one more very important fact, because I want to honor the work of the CDC over the last 20 years in focusing in on the syndrome of prediabetes. So right now in the United States, about 11% of the population has diabetes. However, about 35% has prediabetes, which is both usually obesity plus elevated blood sugars. And that group will all have diabetes in the next 5 to 10 years, unless they change their lifestyle. And what the CDC showed is if you can lose 5% of your body weight, which is not a lot, if you weigh 250 pounds, that's 15 pounds. It's not a lot of weight loss. And you walk half an hour a day, 5 days a week, you reduce your risk, depending on your age, between 58 and 71%. That's a big savings. That is actually where there's a huge need. And the CDC created a diabetes prevention program. It's a group program. It's in the community. Now we have an opportunity to bring a more qualified coach and move it into the healthcare system to address that. That's the next epidemic. So if you think about it, we had the wave of obesity. Next is the wave of diabetes. And then the wave after that will be of dementia. And so this is very big priority in healthcare. So I think people will wake up to that and realize, my gosh, we have to do something about this sooner than later.
Yeah, well, you mentioned some of the science behind it and some of the impact that can be made by simple weight loss. 5% of your body weight can lead to some dramatic impacts physically as well as financially. And I don't think we can really talk about scientific bodies of evidence or behavior change without also recognizing the need, excuse me, for business model innovation and business model change. And the CPT codes are a key part of that. So we've talked kind of high level on it, but what does it really mean? Can you dive in deeper on the CPT codes that you mentioned that the few that were approved back in January, the attack that you withstood and were victorious over earlier in the year, right before the pandemic hit. So can we get into some brass tacks about what exactly those CPT codes are and what that means practically to the individuals who are working in the industry, the people who are taking advantage of these services? And then I want to get into next about how this affects corporates and private insurers.
Right, good. Well, what's important about the payment or coverage of services by coaches is that, different from a technology, it's only viable if there's sufficient revenue for the clinic to pay at least half-time salary of a coach. You can't really just have a few people that get coaching and make it work in the clinical world, in the financial model. And so that means there's got to be a large enough volume of patients for whom coaching is an important intervention that can really make a difference. And so we've been working on 3 fronts in order to increase the financial base to allow that to happen. So one is that we've been talking to Medicare. The CMS is the Center for Medicare and Medicaid Services in Baltimore, about the coach's use of currently paid for services, currently reimbursed services. So when the Affordable Care Act came along with it came something called an annual wellness visit. And in the and in that definition, they introduced the health educator to the healthcare team, which had never been mentioned in any other services. And so the health educator was never defined. And so with our legal advisors, who really held our hands because this is a complex process, they helped us form our case to CMS to say it makes sense. And we'd also, with the new CPT codes, which had already been published, we had also included the certified health educator as a coach eligible to use the new coaching codes. So we're basically saying, from a policy standpoint, look at the health and wellness coach and the health educator as the same professional. And in the case of existing services, the health educator can deliver the health annual wellness visit, which fits perfectly with a coach. There's some medical pieces that need a nurse, but you do a health risk appraisal and you develop a personalized prevention plan, which are well within the scope of a coach. And there's a fairly good reimbursement for those services. So we said, well, if the coach is equivalent to the health educator, and then the health educator is considered by another set of definitions auxiliary personnel, which can work under physician supervision and deliver certain services, then basically the coach can do the annual wellness visit, but they could also deliver obesity counseling services, depression and alcohol screening, and they could be on the team delivering chronic care visits. And there's also now remote patient monitoring. There's a few things. So we spent a good 18 months getting that clear so that we could give guidance to the coaches and the healthcare systems is this, you can do it this way. And then we had consultants help us think about the strategy for the new codes, which include a 1 hour startup session, a 30-minute ongoing session, and then a group session of at least 30 minutes. So we designed a strategy focused largely on this obesity population and prediabetes that I was talking about, and as they say, crosswalking from a sort of equivalent services. So that means we can say to payers, you can cover the existing services, or we can use the new codes, and it would be probably sensible to use the new codes, because then we can track those services. We can, tweak the patient groups that get coaching. We can look at what's the optimum dose. Lots of things we can do if we keep it separate. So those are the kinds of, it's the way we're sort of thinking about approaching the payers, and so it's either use existing services or the new codes, and then serve this population that everybody understands is driving over a cliff.
How does the introduction of CPT codes actually impact corporates, for example, that are paying for their own healthcare? Does this help accelerate their adoption of these services as well?
So yes, probably don't remember the exact number, but maybe half of adults are covered under employer healthcare plans, and a good number of those, if they're large enough, they are what are called self-insured organizations, which means they have their own insurance. It's not even insurance. They pay for all of their healthcare costs. They don't have an insurance plan. And they do that because about 35% of health plan costs are administrative. And so they can save money by paying, someone just to do the paperwork, and then they make the decision. Those plans still use CPT codes for services. So yes, and self-insured employers can do the same thing.
And then once the category 3 codes are sort of introduced, how long is it? What's the sort of time frame between that and actual reimbursement? How long does it take?
So there's 2 lanes here. So one lane is that you go back to the AMA. So the status of these codes is category 3, which is sort of the entry level. And there are 2 main things that are needed to get to category 1, which is then the codes become kind of accepted and move into, certainly Medicare reimbursement doesn't happen until category 1, and a lot of payers wait until category 1. And the 2 things you need to do is to have an evidence base for the services that meets AMA standards. And the second thing is you need to show wide utilization by, say, hundreds of coaches, you reporting the codes in electronic health records to show that this is happening, even if it's not being paid for. And we're on the way. The evidence base as it is now meets the AMA standard. So we have sufficient studies. Now what we need is to get the tracking data, and we've assembled a collaboration of 3 academic institutions to organize all that and pull all the data into one data set. And then the Veterans Administration is also who sponsored the new CPT codes, so they're also interested. So basically, the 2 groups are collaborating. So within the next couple of years, 2-3 years, we'll be getting it done either way, combination of both ways. Oh, and then the third thing. The third thing is the CDC's diabetes prevention program, which already is being paid for by a number of payers, and so we're piggybacking on that success as well.
Great. So you have these codes in place. The industry, the professionals. There's a credentialing system. There's a way of certifying and testing and training and developing health and wellness coaches. What's next? I mean, because I imagine the next part is you need to have a demand. And certainly there's a demand in terms of the population that could use it. But how about actually reaching them and having them be aware that this is available and that it can work for them?
Yeah, so the advantage of putting the health and wellness coach on the clinical team, like primary care team, is that you have a population of people who are getting ongoing support, right? Ongoing medical care, because the physician, for many people, their relationship with their doctor, primary care doctor, is something that goes on for years. And so that putting the coach into the primary care team is, and this is something that, we've been working toward for a very long time, because coaches work in corporate wellness and they work in private practice. They work in lots of different domains. They work in retirement homes. They work at, my organization, WellCoaches, has trained many coaches at the Indian Health Services. So there's coaches in lots and lots of places. But improving one's health and lifestyle is a lifelong journey. And the advantage of being implanted and embedded in the primary care team is that that's the team that is with you on your lifelong medical journey. And so, so when the coach is aligned with the medical team, then the medical team is, and this is happening, I'm very close to the group that's been doing this at Mass General Hospital for more than a decade. And so the physician and coach are collaborating very closely, and the doctor has the conversation with the patient in the annual physical or special visits, or maybe even an annual wellness visit, and talks about their health and what are they doing and what do they want to do, and then can determine whether they would be willing to get support to change their behavior, to get more engaged and get more proactive. And so then the physician uses their relationship of trust to say, I really would like you to work with this coach. Would you, be willing to try it out? And rarely do, when the coach is in the practice and in the office, so to speak, rarely is it turned down. And if they don't want to this time, they might be a year from now. And so, and coaching isn't one and done either. You don't just change your lifestyle and you're done. And if you have multi-year relationship, you can work with a coach in campaigns when, you're ready to work on the next thing. So I think the longevity of the relationship is what makes this the most compelling. And we see that in the practices today, where they've found funds and grants and other things to pay for the coach, even without reimbursement.
What do the coaches need to do to be prepared for being reimbursed? Is it for all coaches, or are there particular classifications or groups of coaches that are eligible?
Right. Well, so, the reason that we put in the decade of work to get to an agreement on standards and a national exam was so that that would be the gate that through which the coach goes in order to be able to work on the healthcare team. Because the coach wants to be accepted as somebody that has passed through a gate, just like nurses and social workers and dietitians and everybody else does. So that's why that was so important that we aligned. And I mean, we donated, all of us, a day or more a week for 10 years. I mean, we really leaned in to make this happen. I mean, we've written 600 examination questions. The amount of work that it takes to get to this was a work of a very dedicated group, probably like about 10 of us, that for years after years after years, we just kept going, sometimes with no money. And so, that was because we could see that we could get to this day when then there was a credential that the healthcare world would say, okay, there are standards here. These folks have to learn, how to coach. And well-trained coaches are effective. They engage people. People go through transformational change. They really do change their lives with good coaches. And so I think we're there now. We just got to get the whole system, the systems and the payers on board, and then roll it out.
I'm going to ask you to bring out your crystal ball for me. I know you have it down there just right out of the camera shot, right? So if you can just get out your crystal ball and look into the future. I imagine if I'd asked you in February to predict the future, it would probably have been very different to what we've experienced. But looking ahead, and given your 2 decades working in the health and wellness coaching industry, what do you sort of foresee as we emerge from this pandemic in the months and year or so to come, and we get into the next phase of all these pent up health demands that are continue to exist while we're being occupied with other activities inside the healthcare system and without the healthcare system. And then beyond that, as the population continues to grow, both in number and in a number of cases with these various health conditions.
Yeah. You know, I'd like to reframe that question from what's the crystal ball to, you know, what path are we putting into place? Because it's up to us coaches to make this happen. You know, it's not going to happen if we don't get up every day and continue to do what we do to get the message across, to spread around. So we're making the future. The ecosystem of healthcare is vast. And I mean, as a Canadian who also lived in the UK, the complexity here is mind-boggling. It's mind-boggling how complex. So it would be naive of me to make any predictions anyway, because there's so many moving parts and there's so many forces, and you're talking about big tech, big payers. And so how a gang of coaches, well-meaning, well-intentioned, very capable, competent coaches, how do we actually change the system is no small feat. I do think, though, the need is so great that, you know, people need help. They need help with. One little bit of science. There's a meta-analysis of 48 health behaviors, and there are two variables that determine whether people make sustainable health behavior changes or not. And it's the relationship of your internal motivation and your confidence, or the number of, which is also measured by the number of obstacles you have. And 80% of adults in any given behavior, it's same in workplace behaviors, 80% of people do not have adequate motivation or confidence to make sustainable change in behavior. It's not going to happen by themselves. I mean, maybe with community programs, the conversations that are needed in group or one-on-one are, how do you help someone fire up their interest? And they're not interested in health per se. They're interested in the life they can lead if they're in good health. And that connection doesn't get made until you lose your health. Yeah. And so the only way to get at your deepest motivation is to have someone in a deep conversation about, you know, what's important about this for you. What is it? And then the second part is that you take the motivation, the energy, the fuel, and you have to build the competence and the skills and the what's called efficacy by psychologists. And in neuroplasticity terms, the Alvaro Pascual-Leone at Beth Israel, who's a neurologist and an expert in neuroplasticity, teaches us that you can only grow 1 millimeter of neural network a day. And that means you can't make a major overhaul in your lifestyle in weeks or months. It's an ongoing, continuous process of building skills, building new neural networks. That's real change. That's not easy. And to do that by yourself and without the skills is, really difficult. And so that's really why I started out in this field, was to create the skill set that could consistently help people find their intrinsic motivation, build their confidence, get healthier, and live a great life. And it's not just physical health. We now know that your emotional health, then as per your number of positive emotions you have every day and your satisfaction with your life, are actually at least, if not more, impactful on your physical health than the other way. And that's because physiologically positive emotions improve vagal tone and immune system function, and downstream from that, and ultimately reverse the results of chronic disease and loneliness and depression and stress, impairing your immune system and driving you down the road of chronic disease. But you need to have enough positive emotions to engage. There's a new study out this year from a big Gallup survey. You need to have a sufficient level of positive emotions to engage in healthy behaviors. So you don't just get the physiological hit of positive emotions, you actually need, so that means people have to, and right now half the population is depressed, anxious, PTSD, grieving. They don't have the positive emotions, the psychological resources to make sustainable change. That doesn't happen by itself.
Yeah.
It just doesn't. And so it's essential that we've got people who have the skills, that know how to have those conversations that move people, over the long term through the process.
Well, you need to have them trained, and you need to attract more people to replace them, right? Because people aren't going to live forever and work forever. So you need to make sure that there's a group of people that are aspiring to become health coaches and create awareness around the industry, so that can attract the people. So how can the industry attract more people into the profession? And what sorts of people should consider health coaching, health and wellness coaching as a career?
There's no shortage of people who want to become coaches. Because if you wanted to have kind of a wild prediction, it probably may not happen in my lifetime. But if we do our job well, in over decades, there will be need for fewer hospital beds and fewer hospital employees and medical employees, and they'll all move into coaching. The health professional world, nurses, social workers, dietitians are looking for something new. They're looking to do something because they're sitting watching their patients in the hospital get heavier, get sicker. They're just watching it helplessly. And the reason they decide to become coaches is because they want to do something before it gets too late. And so there's no shortage. There's millions of nurses. There is no shortage of people to become coaches. What the limiting factor more is that we need to create the models, the business models that show the return on investment, so that the investment is made so that people can shift from one role to another.
So critical. And so one of those chicken and egg situations, you need people going through the program in order to have the quantity of people that you can produce a study that has relevance, and you're able to demonstrate the rigor and the effectiveness for that population. So we're running up to our last few minutes together. So I wanted to ask you, in your years of experience, having worked with a lot of coaches, having, I'm sure, seen a lot of people seeking health coaching, can you give me a couple of examples, or maybe just one key example, about how this has really made a difference in an individual's life in terms of their own performance and their relationships and their longevity? And let's sort of break this away from sort of the numbers and the industry discussion, and really break this down to N equals 1. Tell me about that one person that really touches you, that you think that you're glad that you were able to have a moment in.
You mean me personally?
Yes.
Yeah.
Or someone that you.
Yeah. So no, I have one.
You've worked with a lot of professionals as well.
Yeah. So. Yeah. I one story, and it's actually an entire C-suite team of a big company, where someone with diabetes was able to lose enough weight to go off his meds and not be considered diabetic any longer within just a few months. I mean, there's lots of stories. For me, the most, just to see someone think they'll be on meds for the rest of their life, they'll never be able to drop a few bad habits. They're going to carry this weight for the rest of their life, and then just finding the combination of a few behaviors together, their own formula. Because if you look at the research, you end up with bell curves. If you do, certain number of people following this protocol will get the results, but the others on both sides of the bell curve, or the others on the downside of the bell curve, it didn't help. So there's no way we can hand people a formula. It has to be something that they discover in partnership with a coach. And I just remember the joy of this gentleman discovering that formula. He texted me when I was traveling, and he said, "Meg, my numbers, I can't believe it. This is what's happened." I mean, the joy of that, you save lives, right? You can tell. The other for me, the most heartwarming stories were, I coached 4 people with fibromyalgia. We then went on to build a protocol for fibromyalgia. If you know about fibromyalgia, it's a really, really tough condition with a lot of pain, and no one understands. I mean, there's clearly a nervous system, biological, physiological thing going on, but we've not been able to find. I know one group has found a blood metric that distinguishes fibromyalgia, but it's not mainstream yet. So those folks suffer miserably.
Mm-hmm.
And my mother, I always say, died of chronic pain. It's a long story, but I wanted to help people with pain. And those were really interesting, year-long programs, because they started with hopelessness, helplessness, just like I just don't see and ever coming out of this. And step by step, little by little, focusing on their well-being, not medications, not, they had their own other programs. They got to a place where they could live a pretty normal life. Did they have no pain? No. But by investing in their well-being every day, they could have a productive part of their day. And when the third one I would say
amazing.
Is
sorry.
Do I have time for one more?
Just really quick. We're in the last 30 seconds or so.
A woman with stage 4 metastatic breast cancer. When you have metastatic cancer, the doctors drop you off at the side of the road and they say there's nothing else we can do. And she lived another few years. We had an amazing year of coaching that opened up lots of new projects for her. She went on to like a whole sort of creative phase in her life after that. And that was also, it was hard when she died. But we as coaches, the opportunities we have to help people are profoundly, amazingly good.
It's so important. And thanks for sharing those stories. And I'm glad that you thought of all three of those cases. I think many members of the audience can relate to some of those individuals personally and professionally as well. So really glad that you were able to have that impact with those individuals. And certainly I like to think about all the impact on their relationships and on the people that care about them and they care for, that we're able to have that additional quality of life during their time after their diagnosis or in the course of their health journey. So I want to say thank you very much, not just for your time today, but also for all your decades of commitment, your calling to this industry to create, inform, and be part of the foundation of this industry. It must give you a lot of joy to know that this is going to continue to grow and flourish for the years and decades and even centuries to come. So Coach Meg, Margaret Moore, thank you so much for taking time and being a part of the conference today.
Thank you, Dan. It was lovely to be with you.